Hello and welcome back to my channel. Thank you all for being here. Good day, depending on your time zone. I want to talk about glutathione today and the fastest way to get it straight directly into your bloodstream. If you take your glutathione, say for instance, orally, it has to go through all the gastrointestinal organs and biles of your stomach, digestive organs, which sort of like absorb most of the nutrients, and your body is left with just a teeny tiny little bit of the benefits. So today is to discuss how you can take it to make it go straight directly into your bloodstream without going through all your digestive organ and gastrointestinal process. So please kindly click the subscription button, like this video, and click the notification bell as to get notified whenever I post a new video. Thank you, thank you, thank you, thank you. So what is glutathione? Glutathione is a detoxifier and antioxidant that helps your body and benefits your body in numerous ways. It is enriched with natural ingredients such as detoxification for your skin, overall health, rejuvenation. Glutathione is recognized as an antioxidant, an immune booster for your system, protects the healthy tissues against free radical damage, and supports cell regulatory function. Glutathione also improves the appearance of the skin, diminishes melasma, hyperpigmentation, etc. So these are some of the benefits of glutathione. It increases energy, slows down the aging process, reduces muscle and joint discomfort, strengthens the immune system, detoxifies the liver and cell, improves mental focus and clarity, improves the quality of sleep, reduces effects of stress, improves your skin, and improves performance and recovery of athletics. So just in case you can't see this picture, maybe the writings are quite small, let me just read them out for you. Number 1, best anti-aging supplement. 2, best antioxidant of all. Number 3, brightens skin and clears dark spots. Number 4, decreases cancer chances. 5, glutathione decreases acne, pimple. 6, glutathione boosts your immunity. 7, glutathione helps HIV patients. 8, glutathione may help autism and schizophrenics. Number 9, prevents brain and nerve damages. And number 10, glutathione helps diabetes. So these are just few of the benefits. There's so many benefits with glutathione. Okay, there's so many benefits, and you can Google to get more information on that. So here I'm going to give a brief understanding of why taking your glutathione via rectum, rectally, is one of the best. Okay, drugs and I will make a demonstration of how you can get your glutathione to be administered rectally. I'll make a video of that and I'll show you that. It's in this video, but first let me just give a brief explanation. I'll make this as short as possible. Well, drugs that administered rectally have a faster action than via oral route, via your mouth, and a higher bioavailability level. That is, the amount of effective drug that is available after administration is greater, as it has not been influenced by the upper gastrointestinal tract or digestive processes. Rectal absorption results in more of the drug reaching the systematic circulation, with less alteration in route, as well as being more effective route for delivering medication. Rectal administration also reduces side effects of some drugs, such as gastric irritation, nausea, or vomiting, and all that. So the anal canal is divided into areas above and below the pectinate line. The area below is sensitive to pain, touch, and temperature, whereas the area above, which is called the proximal, is only sensitive to stress. Therefore, once carefully insert your medication, you should not feel any pain within the anal canal, from the anal canal, the internal and external. So there have been number of, ways that you can take aside from anal, which is sublingual, intravenous, intramuscular, as well as oral as well. So the reason why the rectum is one of the best ways to administer your glutathione is because in the rectal canal there are blood vessels, mucous vessels, membranes that when you insert your medication and you hold it, that there won't be any problem holding it because of its stretchiness. And when you hold it for say 10 to 5 minutes to 10 minutes, the components of the drug slowly releases and goes directly into your bloodstream. So whereas where you take your glutathione orally, it goes through the process of your digestive tracts, which is through your gastrointestinal organs passage, and that process gets to eliminate some of the benefits and vital components of the drugs. And say you take a 500 ml of glutathione orally, what will be left after it goes through the process of the digestive tract? What will be left for your body, what your body is going to be left with, is probably like 200 milligrams, so which might not do much for you. So that's one of the disadvantages of taking it orally. But when you take it rectally, you get like 99% of the whole 500 milligrams that you took, and the benefits just go straight into your bloodstreams and does its thing. So yes, now the disadvantage of taking it rectally, there's always a disadvantage. It's because the disadvantage can only be where you don't administer it hygienically. Say your instruments are not properly sterilized and your rectum is not properly being cleaned. For instance, before I do it, what I do is I make sure I have already discharged my bowels, and I take like a cotton board and say about 2 to 3 cotton boards, and I use what they call it, spirit disinfectant to clean the passage of my rectum and cleaning, because whatever I put in there and whatever bacteria that has been lying in there is going to go straight into my bloodstream. You get what I'm saying? So we wouldn't want that. So in order to prevent any leftover residue or whatever dirt that's been hanging in your rectum canal, you have to disinfect it. So disinfect it, clean your instrument, clean your rectum canal, and that's it. That's it. We wouldn't want those residues or whatever gunks to go into your bloodstream. So that's the only disadvantage there is to administering your glutathione rectally. So without much ado, let's go in straight right into the video where I show give a live illustration of how you can administer your glutathione rectally. So by the way, kindly subscribe to my channel, hit the like button, and click on the notification bell so you get notified whenever I upload a new video. Kindly please subscribe. You must subscribe. Please subscribe. Thank you very much. Let's get to the video. By the way, this is me. This is my picture, my before and after picture taking glutathione via rectum. And at this stage, my after picture, I've been taking it continually like this. I do it like every 2 days, every 3 days. Sometimes I do it back to back, today, the next day, back to back. Then sometimes I take a break, say like 1 week. Okay, I take a break, but the results you're seeing here is a result of me taking glutathione via rectum for exactly 1 year, in between the breaks, but overall 1 full year. So that's my results, and my body, I'm so healthy. Like, I have never had headaches for 1 whole year. Yes, never had headaches. The only time I get sick is when I have malaria, not even typhoid, just malaria, because you get bitten by a mosquito and you can't help that. Okay, all right, so let's get straight into the video. So yeah, I have all my equipment for administering my glutathione rectally. I have my 500 milligrams of glutathione now product. For me, this is the best product. You can try other products, but this is the best product for me. And the liquid, this is my cup, which I'm going to dissolve my glutathione into it. This is the liquid I'm using, which is a normal saline, usually for drip, for administering drip, intravenous drip. That's what I'll be using. This is the enema pump, the local one that most people are very familiar with. And this is my 60 cc injectional that I'll be using to administer the glutathione. Okay, so yeah, I'm about to, I want to administer a 1,500 milligrams of glutathione rectally. So I'm going to, they're in a capsule form, not in caplets, in a capsule. So I'm going to open the capsule and take out the glutathione powder and pour them into my cup. By the way, that little cup there, measuring cup, is a 10 ml. And the trick is you shouldn't exceed 10 ml of liquid, because if the liquid is too much, once you insert it rectally, it will start leaking, because you're not pushing too far into your rectum. It's just about 2 centimeters into your rectum, so you're not going too far. If you go too far, it will go straight into your liver. It's not a bad thing, but then you will poop it out. So just 2 meters into your rectum canal. Okay, so now I'm going to get my saline liquid to dissolve my glutathione powder. Please, I need to stress on this. Do not use tap water. Do not use any other water, even except it's distilled water, and you're 100% sure of the origin, because this is going directly into your blood stream. It's going into your bloodstream. So for me, I can't stress this enough. Just use injectional fluid, which is a normal saline, not sucrose. Sucrose is sugar. use a normal saline, which is a salt saline. Okay, and make sure you sterilize your equipment, please. Wash your hands, put on hand gloves and hygiene, because this is going into your bloodstream, I repeat. So sometimes the powder settles on you just have to stir it and see that everything goes in. And even if everything doesn't go in, you just put in a little bit of saline water in the measuring cup again, just to make sure you get everything, and stir it properly. Stir it properly. So even if it settles below, you can still extract it into the syringe. So I'm going to shake what is settled and draw this into my syringe. Okay, so there we have it. Now most people this is what they have. If you don't have access or find where to buy your injectional syringe, you can use your enema pumps, but this is how you open it. You take off the pipe at the mouth, which is very easy. Then the way you get your liquid sucked into the enema pump is you have to squeeze the bulb. That's the water. So you squeeze the bulb and hold that squeeze. Then when you put it in the liquid, you release the squeeze and everything will just suck in naturally by itself. That's it. See, the cup is empty, you know. So you just squeeze it, release it inside the cup, and it will suck the liquid by itself. And you put back the pipe. But endeavor not, this is how far you have to insert it into your rectum, not more than that, not the whole thing. Please, just this much, just this far. See, about 2 centimeters. Please do not insert the whole thing, just that much. Okay, see, it's the same size with the injection syringe. That's why I prefer using the injection syringe, because that way you're guided and there's a stop supposedly that stops you from going further than the length of the syringe tip. Okay, so shake your glutathione liquid, shake it properly, and lubricate your rectum with some Vaseline. Lubricate. Please make sure you lubricate so you don't injure yourself, get a cut, and blood comes out, because that could get contaminated. So you lubricate with the Vaseline, insert the injectional syringe, and just pump it in. If you can't do that yourself, you can get someone to do it for you. Well, I would suggest that you practice on your own without glutathione. You can just practice with ordinary water how to administer it, and when you get used to administering properly, then you can use the glutathione on. Okay, so I try not to make these videos long, but I can't help it. Sorry about that. So thank you all for watching. Kindly subscribe, and I hope this helped. And kindly leave a comment in the comment section, letting me know if this works for you and if this was helpful. I'm glad to share this all with you guys. Thank you, and